Welcome to the Poisoning Podcast. I'm your host, Erin DeLulo. Today I'm sitting down with Ben Flaherty, the director of the powerful new documentary, Shuffle. This film pulls back the curtain on the addiction treatment industry and exposes how vulnerable people are often caught in a cycle where relapse becomes more profitable than recovery. Ben brings not just a filmmaker's eye, but also the perspective of someone in recovery himself. He calls his work on Shuffle an act of witness, accountability, and ultimately love. And you can feel that in the way he tells these stories. We're going to talk about what he uncovered while making this documentary, the real human cost of the system driven by profit, and how he hopes Shuffle and the Stop the Shuffle campaign can push us toward real change in how we treat addiction. Ben, welcome to the Poisoning Podcast.
Thank you for having me. Good to be here.
Yeah, well, first of all, congratulations on the film's win at South by Southwest. What a nice honor.
That was a huge surprise to us, and we are incredibly honored, for sure.
Yeah, because it's just the film, the Shuffle documentary, is not in theaters yet. You can only see it how?
For now, it's on the festival circuit. We have an impact campaign that just kicked off, so we'll be at universities across the country. You can check out stoptheshuffle.com to see exactly where to see the film, but we are working on a wider theatrical release for mid-November.
Oh, wow. Congrats. That would be exciting.
Yeah.
So for me, to sum up this film, and thank you for sharing the screener, Matt and I watched it maybe 2 weekends ago. I mean, like, this is very simple for our listeners here. It's a coordinated abuse of addicts seeking help, like seeking medical help.
Yeah.
Via recovery. That's how I would sum this up, everyone. And it's so compelling.
Thank you.
Thank
you. Yeah, the use of that word is important. I think that on it's a spectrum like anything else, right? And on the most extreme end of that spectrum, yes, it's coordinated abuse. That's what it is, for the sake of profit. What's almost scarier is if you walk away from that extreme, little by little, you walk towards the middle where you think it might be safer. And is it? I'm not sure, because it's a system that allows for that abuse to occur. That taking advantage of that system can happen in a variety of ways. And I guess that's what startled me the most. You know, when I first sort of stumbled into the subject matter, it was the coordinated abuse and that sort of concerted effort to take advantage of people that really caught my attention. When I realized how easy it was to do that, though, and for well-intended people to eventually slip into that, then my concern only grew. You know, it's certainly a topic that we could talk about for hours. You know.
Oh yes, definitely. And I don't even know that within well, I feel this has started really. It grew because of the opioid and fentanyl crisis, right?
Correct.
People saw opportunity to make money at an abusive level. But everyone, even in that policy making sphere around this crisis, they're unaware of this. Which is like why a lot of people need to see it. I hate to say that. They're unaware.
Yeah.
And it's not because they don't want to. There's just so much. They don't want it's not that they don't want the knowledge. There's so much happening in this crisis right now.
There's an incredible amount happening in this crisis. And you're absolutely right. Very few people are aware of this. And I think one of the reasons is because who would do something like this? You know? I mean, that was my first thought is I could not believe that people at their lowest were going to take advantage of them. Now, maybe that's naive of me because that's happening in other ways in society. And so maybe that shouldn't surprise me, but it did. You know, and I think it surprises a lot of other people. It's hard to imagine that it's happening. You know.
I know. So let's start with your story, if you don't mind, and how you discovered this.
Not at all.
This abuse and recovery.
Yeah.
Centers.
I got sober at the age of 41. the thought of getting sober had never occurred to me before that. I'm not somebody who tried many times or spent 10 years trying. I was off to the races, and had not occurred to me. And at 41, I realized one night that I was dying. Like, I could feel that, I could sense that, and I didn't want to die. So I told myself, if I make it till the morning, I'm going to get some help. And again, not knowing what that meant, right? What's help? What does that look like? All I knew is I couldn't do this anymore. I needed to go somewhere or see someone, right? So in the morning, I called my family, let them know that I was an alcoholic. They had no idea. And we made some quick phone calls. And, within a matter of 20 or 30 minutes, I was on the phone with a detox facility in a hospital in Chicago where I lived. And I went to treatment. I spent 9 days in a detox facility, which at this place was on the 6th floor of a hospital. I say that because I think it matters that it was at a hospital. And it was a mix between jail and like a psych ward. That's what it felt like. There were no amenities. It was a locked unit, meaning you could leave if you wanted to, but like you would have to exit the program. You couldn't come and go as you pleased. So I was there for 9 days, and I was in rough shape. It took me 2 or 3 days before my body was stable and I could think clearly. And after about 7 days, my counselor asked me what my plan was. And at that point, I thought, well, I'll just get out of here and I'll go back to work.
After 9 days.
After 9 days. And he sat me down and he said, so after drinking for 15 years with no breaks, you come in here for 7 days and you think now you're going to go back to work. He's like, that's a terrible plan. And, I one of the things that I'm privileged with is a part of what I struggle with is thinking I'm always right, like that I got this. So clearly 15 years of drinking lands me in this ward, and I think I still got this, and here was someone telling me that I needed a different plan, and I listened to him. And he suggested I go to this partial hospitalization program. It was called a PHP program. This was called the professionals program at this hospital. It was geared towards people who had a career mostly, whether flight attendants and firefighters and stuff like that. And that was a 6-week program, and it was great. And I stepped down, to an IOP, and I lived in a sober home for a year, and went to meetings, and this was fantastic. And it was transformative experience for me, About 6 months into my sobriety, 8 months, I was having coffee with a friend who was in AA, and he was telling me about his experience getting sober in Florida. And just in passing, he mentioned how down there were people who would recruit kids into rehabs. And I said, say that again? And he said, yeah, it's the insurance. They recruit people into these sober homes, and then they bring them back, and then they work out the insurance and maybe send them to a different facility. And he told me to look it up. It's called sober home fraud. And I did. and I fell down a rabbit hole. It was happening down in Florida, and no one was talking about it. So I dove in, and I'm rambling, so I'm going to cut here for a second.
No, you dove in, but let's talk. So you didn't experience this at all in Chicago.
No.
And so do you think this is more of a problem again in the opioid fentanyl space or polysubstance space than it is in, say, helping someone recover from alcohol?
I do for a lot of reasons. I think, the scam, if we're going to call it that, really targets people 18 to say 27, often kids that are on their parents' insurance, that is the age group that the opioid epidemic is ravaging, among others, right? And opioid addiction, again, I'm not a doctor. I've never struggled with it. It's not something I can speak to, but it's a different type of addiction, it seems. And it has different physiological consequences to it, brain chemistry and such, that make it a different animal, And so I do think that it targets that population. I also think it was an interesting sort of confluence of events. I think the opioid epidemic created addiction on a scale that we had not previously
Right.
been aware of in this country or experienced. And at that same time, through the Affordable Care Act, insurance was subsidizing treatment. And so this was this perfect storm of a massive amount of people struggling with now a potential way to navigate the treatment system for them that was lucrative for other people. And fraud sort of thrives in an environment of opportunity.
Yes. You bring up, so this is in my notes too, how young you follow and interview people struggling within this system. I don't want to give
Mhm.
everything away, but you
Nice.
follow a few individuals, and that's what struck me is how young they were.
Right.
So when you you're in your early 20s, maybe even younger, you're going to rely on your parents. But one of your subjects is from Appalachia, not far across the West Virginia border. And like, what resources and know-how do his parents have to know how to help him, right? Doesn't it seem great when someone is saying, "Oh, just give us your insurance.
Yeah.
We will fly you down. We will, set you up." And that one, number one, the plane ticket now is like big red flag. Am I
Sure.
right?
Oh yeah, absolutely. Nobody should be paying for your transportation. Yeah.
Right. So, and why do you have to go to Florida? Although, for someone, I mean, Florida's great. I love to visit between like November and April.
Yeah, yeah.
Any they can send me tickets, just not,
Right.
a fraudulent scheme. I do feel like for people who are not involved in addiction policy or just volunteering in the space, what you think of when you think of recovery is like the California coastline and how all the Hollywood types,
Yeah.
that's where recovery doesn't exist in the middle of nowhere, Indiana. I mean, it does, but that's not the public's perception of it.
Exactly. That isn't the public's perception of it. And perception, as we all know, goes a long way. And there are facilities, in Florida and in California that have done a fantastic job of marketing themselves more similar to the hospitality industry than they
Yes,
have any sort of healthcare.
it's like
And
massages and
yeah,
yoga and
which has nothing to do, let's be honest, with getting sober. You know what I mean? And comfort doesn't necessarily make you sober. I remember on my fifth day in detox, I was walking back inside from having a cigarette and I walked past the nurse's station and I said to the person next to me that the bed sheets felt like sandpaper. And the nurse, without even looking, she just hollers at me. She's like, "Honey, do you know where you are?"
I love that.
Yeah.
I mean, she
Thank you to
sounds like
her. Yeah.
a character in a movie, right?
He was a boss. Yeah. But it was truth. And so yeah, they do market themselves like that and the perception is that. And I can speak for myself, like I didn't know anything about rehab before I needed it. I didn't know
Right.
what it was. Like you mentioned, my perception of it was palm trees and a beach and somewhere, nice.
Yeah.
Um and I also, yeah, and it's not that. I also think the times are changing and it's a lot. There's really no reason to send anyone out of state anymore. You know, um, there are facilities in most states locally. But I wanted to touch on, you mentioned
Yeah.
Daniel's mom in,
Yeah,
in
Daniel.
in Kentucky. She speaks so wonderfully about this. In that moment of desperation, when you're trying to find help for your loved one and someone comes and offers you this opportunity, like who isn't going to take that? When someone says, "I got you, I can help you, I can get your son the help he needs. In fact, we're going to fly him out there. In fact, we want to help you so much, we're going to waive the deductible. We really need to get him into treatment." Like you're going to take that offer most of the time because that's
Yeah.
not the moment where you stop and like critically think or you do research. I mean, that's a do or die moment, pardon the pun, but and so you you know with that understanding, hmm, the predatory nature of it really comes across when you think about the desperate place that parents are in those moments.
Yes, a desperate mother in Pikesville, Kentucky. I know exactly where that is,
Yeah.
in Appalachia. Who knows? Maybe they're very well off and they're traveling every month. You know, I'm blessed in my day job. I mean, it's a blessing, a curse. I spend a lot of time in airports. But I also know, because I live in West Virginia, Ben, I know people who've never been on a plane,
Hmm.
ever.
Hmm.
So if they have a child coming to them with in crisis, and
Yeah.
they've never even gotten on an airplane.
Yeah.
Like they're thinking, oh my, like what am I going to do? I can't even understand the overwhelmingness. And I've said this many times in other episodes, but I do feel it in Appalachia, the church is still alive, but the church is failing a lot of people by not providing resources. I would say overall, at least in my area, you should be able to go there. If you're a church member, go there and have someone help you with this.
Yeah.
They're just as clueless. So our lack of community, I don't blame Daniel's mom at all.
Yeah.
But I think
Yeah.
what we've learned is warning sign one, plane ticket,
Oh
warning
yeah.
sign two in recovery will waive the deductible.
Oh yeah.
Has anyone, I have never seen a doctor or dentist who's like, let me waive that deductible.
Yeah.
Not that they aren't great people, but they
Hmm.
have to pay their bills too.
Yeah. Well, and that just shows you how much money that these insurance reimbursements for treatment, that's how lucrative they are. It's worth it to them
Mm-hmm.
to absorb that deductible in order to be able to bill that policy. They'll get their money back, 5, 10-fold. It's a really, it's really disturbing
And is
when
there anywhere else in medicine where you can waive a deductible and make that money 5 to 10-fold?
not
Mm.
as easily or quickly as you can in addiction treatment, I would say.
Yeah.
I mean, truthfully, anyone offering you any type of incentive to go to treatment is a red flag, whether that's a plane ticket, whether that's a waived deductible, I mean, it could be a pair of shoes. I've had kids offered clothing and nice
Mm.
jackets and,
Yeah.
so any type of incentive that's being offered from a treatment center is nonsense, you know?
That it's completely
Yeah.
insane. And in this model with the coordinated approach of abuse by these recovery centers, it's a wash, rinse, repeat.
Hmm.
But I came up with test, then drug, then repeat.
Yeah.
Is that right?
Yeah. Yeah. There's so, I look at it as like revenue streams, there's a
Mm-hmm.
lot of revenue streams when it comes to treatment. There's the stream of the actual treatment, the billing of treatment facility, whether that's a day in detox or a day in PHP. But then there's all these other billable services. There's the urine testing that happens sometimes quite unnecessarily. All kinds of other medical services that go along with this. So it's like a wheel, it's like a rinse and repeat wheel, and you do it once, and the insurance starts to sort of wear thin, or think of it like your credit card's getting a little full. Well, then it's
Mm-hmm.
time for a relapse because that resets the card. The horrible part of all of this is that cycle,
Mm-hmm.
that financial cycle, is the same cycle as addiction.
Right.
Like, so you don't really have to do anything for the person struggling to get them to do that. It's natural. They're going to, what does someone struggling with substance abuse do best, perhaps, is relapse. That's part of being, of struggling with addiction. And so it's remarkably simple to let someone stay sick,
And one of your subjects, the female, I'm sorry that her name escapes me,
Nicole.
Nicole, she had been in Florida how long going through
Yeah.
this cycle? How long?
She got to Florida at 22 and I met her at 29. So she had been in it for 7 years, as well as Corey, in the film. He had been in it for
Yeah.
almost 8 years. And when
And
you
is
think
it
about
like,
that,
go
go
ahead.
ahead.
Well, I was thinking like Florida, like it's easy. You could like live on the street easily during certain times of the month. So if you leave for a while and think you're going to try to be independent, and even if you're just going couch surfing, sleeping on the beach, wherever, it's much easier than, I don't know, Minnesota in January.
Mhm. Yeah. No,
Do you think?
you're absolutely right. And I think that's one of the things certainly that the kids kept in mind. They knew that if they got kicked out, well, at least it's warm. But that's
Yeah.
another thing that these centers thrive on is when you have kids isolated 1,000 miles from home and 1,000 miles from their support system, the threat of having to live on the street, it doesn't sound great. Maybe it's a day or two, but those kids are going to want to have somewhere to go. And it's
Wow.
real easy once they get kicked out, they know they can relapse and get back in, so they become sort of a willing part of the cycle, not to any fault of their own. But it becomes much easier to get their sort of buy-in to this when you do have them isolated, from a support
Yeah.
system.
So far away. No one's providing them a plane ticket home, are they?
Oh no. Free
Wow.
free tickets here, no tickets home.
No, no tickets home.
You know.
So let's talk about liquid gold because it actually came up in a conversation I was having last week. So liquid gold is, tell us.
Urine.
Mhm.
Let's talk about pee, folks.
Yep.
This shocked me because I've been in treatment. I lived in a sober home. When I was in treatment, you do it once a week. You pee in a cup. They seal it in a bag, and it's obvious that bag is being delivered to a lab, right?
Hmm.
And that, because there's a hospital across the street, that seemed normal to me. And then when we got to the sober house, we were randomly tested there. No more than twice a week, usually once a week. We didn't know when it was going to happen. There were a big box of cups, disposable cups. The house manager would hand them out. Pee in the cup, check it, dump the cup, throw it away. There was no lab. It wasn't going anywhere. It was just the $20 cups from Walgreens,
Yeah.
So the price of those things never occurred to me.
Mm.
When I started looking into this, I was looking, moms were showing me their EOBs from their insurance companies, and I was seeing urine tests for $3,500, sometimes $5,000. And I wondered to myself, like, okay, hey, how is that possible? But what's the difference between that and the $20 cup? I mean, very little, to be honest with you. I mean, a doctor or a lab
Yeah.
technician will tell you that the laboratory testing has, a greater sense of accuracy and maybe can detect things down to a more minute level. But for all intents and purposes, these disposable cups are just fine. But that really is the backbone of this scam, in many ways, because these kids are drug tested 3, sometimes 5 times a week. I mean, if there's no purpose in drug testing someone every day, because that won't
Right.
show you anything. You know what I mean?
It's not going to change much.
No, no. And if you test them even every 2 days, it's like that. Had they used any substances, you're not even giving time for the substance to leave the system, on and on. So it just became clear that this was a huge money making operation. And when we started to look at relationships between a detox facility and a partial hospitalization or treatment center and a sober home, we started to realize that some of these were forming networks, and there
Hmm.
was always a lab a part of the network. So all of the clients were basically, all of the urine from all of the clients was being sent through a particular lab that obviously had relationships with each of these facilities. So there was some sort of mutually beneficial relationships happening, right? Um, and the urine testing is just so incredibly lucrative that it started to become obvious that many of these networks were having, a connection to a laboratory, and it increases their revenue, hundreds of thousands a month.
So some of these recovery centers, the same people who own the recovery centers, owned a stake in the laboratories testing
Mm-hmm.
the liquid gold,
Yes.
which was making them the
Mm-hmm.
5 or 10 times fold money,
Mm-hmm.
maybe more.
Maybe more. I mean, the insurance, the difference between what these places bill the insurance for and what the insurance actually pays can vary, you know. But on the regular, the insurance company is paying $1,000, $2,000, sometimes $3,000 per test at these labs. You can imagine how quickly that adds up for, at least, if you have 40 people in your facility, or 50 people, and you test them even twice a week, it starts to get, pretty lucrative. And when you have these beneficial relationships with a lab, these kickback arrangements, I mean, that word kickback is a word you can use throughout this. You scratch my back, I'll scratch yours. You send me clients, I'll send the urine to your lab. How's that? Deal? Great. And you could argue, who gets hurt by that? Right? Well, once you start providing any financial incentive to people either in recovery or providing recovery, it's going to create a huge problem,
Definitely. And I had this conversation with one of our day report centers, which helps people who are in court-ordered mandated drug treatment. And I'm a huge fan of his. He is a recovering heroin addict. He's been a guest on this show. And he was sharing with me how another day report center in the other part of West Virginia was caught overbilling for urine tests. And they're a government funded entity. It's not even a for-profit. So now all these regulations and rules have come down on every single other day report center that is going to make it harder for them to get reimbursed.
Yeah. Yeah.
So
and
that apple can always, ruin the bushel.
No, and that's a great point you make. The fraud ultimately makes it harder in the long run for people to find and receive good treatment. Right. But what you said also kind of goes back to what I said at the beginning of this, which is that on the far extreme end of this is a very calculated, coordinated effort to take advantage of people.
Yeah.
But because of the mechanisms in place, the financial sort of structure that allows that to happen, you can find otherwise good facilities that will engage in a portion of this because it's really lucrative. So the urine testing is a great example. You'll find facilities that are connected to others that provide good care or are thought of as providing good care, but it's a very slippery slope when you get into some of these very specific areas.
And then policymakers just want to do one blanket thing. Because it's easy. I mean, it's hard. It's hard to take a scalpel to the problem.
It's hard to take a scalpel to the problem. Very hard. And to make matters worse, we are not. It appears that we are not living in a time that allows for nuance or subtlety or conversation. Yeah. Everything is blunt force, and that's a tough way to treat anything, any issue. Certainly this issue. I think that there's also, when it comes to policymakers, what I've discovered is that many of the people who make policy in this country also profit off that policy.
Oh, fascinating.
That's a problem. If people who create policy are profiting off the policy, we have to question the policy. Who is that policy good for? I came across that in this film, with some of the people.
We're going to talk about it.
Created, we'll get there. Yeah, for sure. So I'll hold that thought. But one of the other things I was going to say is, one of the if you look at a 20,000-foot view of addiction in this country, it's a very expensive problem for the federal government and for state governments.
Sure.
Untreated addiction is massively expensive.
Mm-hmm.
What they've noticed, though, is that simply by treating it, by providing treatment, by offering treatment, and by treatment, I don't mean recovery. I just mean treatment. So take these people that you had been doing nothing with, and now you engage them in a different way, right? The government saves billions and billions of dollars a year, and no one needs to really get better in order for them to save that money. Do you get where I'm headed with this?
Yeah, I do.
And that's hard numbers. Like, that's not me making this up. I mean, it's math. You know what I mean? Math doesn't really lie. And so by engaging these people in treatment, the efficacy of which you could call into question, but to them, it's already a solution because we've engaged them in a different way. Many of the high cost is due to drug-seeking behavior, right? So if you can curb the drug-seeking behavior by having them in treatment, even if it's repeatedly, and we've come up with a host of pharmaceutical solutions as well that reduce the cost overall for states and for the federal government. And that to them is a win. Is it a win for the people who aren't getting better? Or, I mean, the recovery rates aren't necessarily rising. But I'll tell you what is rising is that, this year, addiction treatment generates around 52 billion a year. 3 years from now, it's set to generate 60 billion. So it will, the lucrativeness of this industry, the revenue it generates will keep growing, but are people getting better at the same time? I don't know.
That was one of the interesting points that I think her name was Pat from the Palm Beach Post made about sober homes. When did sober homes become a big business? It really should be like a nonprofit humanitarian run
it should
program.
100%.
And that's her saying it. And I thought, wow, okay. Is anybody thinking that?
Once they realize what they could do with urine, And, that's another red flag for people. When you're dealing with a sober home has nothing to do with your insurance.
Okay.
If a sober home is asking for your insurance, red flag.
Okay.
A sober home insurance does not pay for sober living. It should have nothing to do with it. And in many cases, it does. Sober living will be free for some people magically. Well, how's that? Well, again, it's like the deductible. The insurance reimbursements are so lucrative that they'll let a kid live somewhere for free as long as they can bill their insurance.
Wow. So did you have to pay for your sober home experience, Ben?
I did.
Okay.
I did. I lived in a home with, it was an apartment. There were 3 other apartments in the building. I had 4 other men in my apartment. And I paid around $900 a month for that room. I had a single room with a single bed. I would joke with people that I would have to step out of the room to get dressed. That's how small the room was. But yeah, I paid $900 a month, to live there.
So there's some buy-in, sort of like a responsibility.
Yeah,
right?
I had chores too. You know what I mean? It was like it was serious business there. They were meant to get you better and get you out.
And were there repercussions if you tested positive for a substance?
Mm-hmm. There were, and you had to leave the home for as long as it took you to test clean.
Okay.
And what you did in that time was up to you. You could go with the family, you could go to a friend, but you had to leave the house until you could test clean.
Yeah. So there was like an accountability.
There was an accountability for it, too. And that even seems rough to me sometimes. It's because I thought I was fortunate. I had family nearby. I had support system. If that had happened to me, I would have had somewhere to go. I don't know that everyone else did. And so you can't.
It's hard. It seems rough. It does seem like rough, but at the same time, is it fair to the other people in the sober home if you're not sober? Because you could lead them, open temptation when they're not really fully on their feet.
Yeah.
I know it's hugely debated, housing first versus sort of an accountability model, but we only have so much time today, and that's not the topic of your film.
No.
But we will now talk about the Affordable Care Act, which you referenced, / how some people think of it as Obamacare, and how this has opened the door. How do you believe the Affordable Care Act / Obamacare opened the door for this abusive system?
Well, I think it did so very, very unintentionally. I think Obamacare, I think the Affordable Care Act does an incredible service to this country and to the healthcare system in this country by providing it to people who would otherwise not have access to services, variety of services too. I also went to treatment with my insurance that I have because of the Affordable Care Act that covers addiction treatment. So it serves a need, right? And it is a huge opportunity that it creates access to services. I think there are some unintended loopholes that are in the Affordable Care Act, and not just the Affordable Care Act, the Fair Housing Act, the Americans with Disabilities Act. Those are all laws intended to protect people that have that unintentionally can do some harm. For example, sober homes, you can't inspect sober homes because of the Fair Housing Act and the Americans with Disabilities Act. You just can't inspect them.
That's insane.
So anything goes in there?
Yeah.
I guess.
Wow.
Right? That's disturbing. There are agencies who are trying to, provide some guidelines,
Mm-hmm.
but in terms of why can't there be general inspections of a sober home, it's because of those two laws. That has nothing to do with the Affordable Care Act. But back to the Affordable Care Act, it provides access to treatment, right? So now insurance will cover addiction treatment. And one of the unintended parts of this is the way it deals with relapse. It considers relapse, an essential medical condition, and it covers relapse. So you can't get into a treatment facility without testing positive. You have to show you're on drugs. But similarly, if you are in a treatment facility and you relapse, it resets your insurance.
Wow.
So it's unintentionally providing a financial incentive towards relapse for providers of care and for the individuals themselves. They know if their insurance is running low and I'm going to get kicked out, all I have to do is relapse and my coverage will re-up. Similarly, a treatment center owner knows this, right? What's also interesting about the financial structure of treatment is that detox pays the most. It's the highest level of care.
Sure.
But as you step down from treatment, and as you're stepping down from treatment, we can assume you're getting better, right?
Mm-hmm.
You're moving towards recovery. You become less profitable. Each level of care pays less than the one above it, which doesn't really make much sense, but it does. And so if you get to the end of treatment, your insurance isn't paying very much. And to a treatment provider, potentially, who's looking to keep their beds full with high-paying clients as best they can, a relapse is a good solution. Takes that back to the highest level of care, So the financial structure and the payment structure really works against the cycle of recovery, in a lot of ways.
Oh, sure. But I cannot imagine if they changed it, there would be an outrage.
Well,
To try to give it a little more of a measurement.
I know, yeah, you're absolutely right. There would be an outrage. I think a large part of the problem is that these reimbursements aren't based on successful outcomes.
Right. So the reimbursement for the liquid gold, that does not help anyone's outcome.
No, you don't need to be getting better for the insurance company to pay them. Like the payments aren't based on health, on getting healthier. I think that, if you were to create a financial incentive for these treatment centers where payments only happen with successful outcomes, you would find recovery rates increasing, because then we're incentivizing recovery and not relapse.
You're right. Wow. Yeah, that could be great. So why don't you tell us a little bit about Thomas, and I'm going to say it right, McClellan? McClellan. Sorry.
Thomas McClellan. Yeah. I've never met Dr. McClellan. He's very well respected in the field. I want to acknowledge that. What I have found, problematic is that because he is respected, he has a lot of influence, and he had some influence in the Affordable Care Act and beyond that. He was the assistant deputy director at the Office of National Drug Control Policy under Obama, and has held positions beyond that. We uncovered that there was some profiting happening behind the scenes, and I won't get into the details of the first one, but we trace some money back from some fraudulent treatment, one particular fraudulent treatment center, back to a family member of his, and later, I learned he was on the board of directors of Indivior,
right,
the makers of Suboxone.
Mm-hmm.
And my concern here, in general, is, like I said, is if the people who create the policy in this country are profiting off of that policy, then we have to question, who is this policy actually good for?
Right. So that's what I was asking, like with the Affordable Care Act, because in the clips you share, he sort of takes some credit for helping expand coverage for recovery.
Sure.
And then we find out through you find out through public financial disclosures, the K1, which I'm very familiar with K1s, but not everyone is, that his family member made quite a bit of money off of a recovery center
Hmm.
that was then later investigated.
Hmm. Yeah.
That is what you lay out. And it's interesting that you can find very little about this online with the
Very
Google.
little.
Very.
Very.
I found a Scripps news story
Hmm.
talking about the Dr. McClellan and his family member.
Yeah.
And then, I think maybe you imply or then Attorney General Shapiro may have given some grace to his family member when other
Yeah. It's hard to
company
say.
folks went to jail. There
Mm,
one of the people went to federal prison for a
oh
few
yeah.
years.
Many of the people, almost all of the people, I would say, with maybe one or two exceptions, face some, criminal charges and jail time having to do with that. Certainly, the people who were at the top of uh, the list of people who are benefiting financially from that situation, the top the top earners, so to speak, all face
Yeah.
some sort of consequences with his exception and his son's exception. Um, you know, people can draw that inference as they will from that. That's a tough one. My thought there is, I've read that he had no idea about that. Um, my response would be, someone. I find that hard to believe for someone in his position,
Right.
with the extent of his knowledge and work in the field, which extends decades, that he would not perhaps have been more attuned to what is happening. It's like you're an expert. You're an expert. You can't say I'm not an expert in this situation. So
Yeah, so he understood the the openings that the policy may have indirectly created, and the family member figured it out as well, and it's a close family member.
I think again, I can't say that he knew or he didn't know.
Okay.
I'd like to think that he didn't, but I
Yeah.
also think that, like you astutely put, he is someone who had the wherewithal to understand the ins and outs of a particular situation and a particular policy and what that could do. And
Mhm.
as he well should, given that he is an expert in the field. And so I find it hard to believe that something of that magnitude occurred without him having some idea of what might have been going on there. Whether he had direct knowledge or of it at any point, I can't say. But um, I'm going to leave it there.
Okay. And he has not you've reached out for comment from him and there was none?
Yeah, we reached out for comment, and we sent him a letter, a right of reply that
Mhm.
was very professional and let him know exactly what we were going to talk about, and we haven't heard from him.
Yeah.
So it'd be great. I'd love to sit down with him sometime and have a conversation.
Is he still involved with Shatterproof?
To my knowledge, yeah. Hmm. Yeah.
Interesting.
And I don't know in what capacity.
Yeah, it doesn't show up easily in a Google search, but if you put his name in Shatterproof in a Google search, it
Yeah,
comes up.
he is someone who hasn't been photographed very much, and
Yeah.
there's limited video clips of him available speaking that you can find, but he's done a pretty good job of like keeping his head down and you know
It's how you I mean, that could be a very good PR move. Just saying.
yeah, yeah, I
Could
don't
be.
know. I know what I can tell you is that I find interesting and not surprising at all, but he is incredibly well respected,
Yeah.
and many of the people that we speak to in the educational community and everything, it's they carry him in the highest esteem. um and my intention is not to tear him down, but to point out things that I find concerning, and things that are a conflict of potential interest.
Oh, it's concerning. So when
Yeah.
everyone sees it, I think they'll be like, wow. And for someone who's been in the public policy sphere for quite a while, and most of my career, I was just like, oh,
Yeah.
yeah.
Yeah. Yeah.
Which,
And, you know,
mhm.
and in his defense, I also want to say that, you know, I could see an argument for people saying, well, you know, regarding his seat on the board of directors of Indivior, which again, he's no longer on that board,
Right.
but he spent nearly a decade on it. People could say, well, why doesn't that make sense? I mean, he is an addiction expert. He's going to sit on this board. He is going to advise them, you know, and to a degree, I see that. I also, though, see a potential conflict of interest and financial incentive to do something. I mean, when you look at the mission statement on Indivior for their board of directors, it is their sole focus is to increase profit for the company.
Right.
It's not to increase health. So, you know.
No, that's basically, Wall Street,
Yeah.
right?
Yeah.
It's shareholders versus stakeholders.
Well, and that's, you know, another thing we speak about in the film is the introduction of private equity into the American healthcare system, and specifically to addiction treatment, because it is so lucrative, because there are so many people struggling with addiction, and because there is no end in sight for that epidemic. That is a very lucrative, you know, population to tap into, let's say, and it's happening, you know.
It is. Okay, now I want to talk about medically assisted treatment, which you get into, because I have been hearing about from West Virginia to Utah,
Yeah.
people are being put on MAT without even needing it necessarily, which then triggers them to have a desire for the opioid.
Yeah. Yeah. This is a really, really complicated topic, and and probably the most divisive topic that we talk about in the film as it relates to the feedback we've received from audience members. I mean, we have some people, we had a woman in Washington who was so upset by the film, she called it a dangerous film. And she wrote to all the film festivals we're going to appear at and said that she shouldn't play our film because we're not for getting people help. And that she suggested addiction professionals be invited if they're going to screen our film.
I feel like I know who she voted for in the last election. I'm sorry.
But you know what, though?
It's such a tribalistic world now.
But
Sorry.
it's interesting.
I just go, you have to.
It's so interesting that you say that, because I had a conversation with her on the phone, and one of the first things she said to me is, I thought this film was produced by ultra right-wing media.
Yeah, I could tell you are not ultra right-wing media.
Right. I thought that was obvious.
I don't mean to laugh at her. That was not my first assumption about you.
That's why I thought her perception might be slightly off base. Medically assisted treatment is a really difficult subject. I'm going to start by saying that I've never participated in that. I've never had not been an opioid user, so therefore I've never taken Suboxone. That said, I've talked to many, many, many people who have. I think the first area of concern is that we're using addictive substances to treat addiction.
Sure.
Which inherently presents a problem, or a potential problem. I think Suboxone itself is a tool, you know, among many tools for recovery. And I think that there are some uses of Suboxone that are fantastic, that absolutely save lives and improve recovery. So my critique, if I have one, is not against the potential helpfulness or importance of Suboxone in people's lives, nor is it a judgment on anyone taking it, because I am an advocate for people feeling better and getting closer to recovery in any way that they can, you know? I believe that. So, but again, when we're talking about Suboxone, we're also talking about a revenue stream, you know?
Right. Yeah.
We're also talking about people with an incentive, a financial incentive to prescribe it, you know? And we're talking about a company that makes it, that has spent almost $1 billion in the last 5 years defending itself against cases of aggressive marketing, deceptive marketing. You know, so there are some issues with the company. Medically assisted treatment itself, you know, I think it's when I said it's a tool like others, I think it is. And I think just because you have a set of great tools doesn't necessarily mean you're going to build a safe house, you know? And a tool can be used for good, and it can be used for evil, so to speak. And when that tool is an addictive substance, it becomes even easier, you know? So I think it's a real slippery slope. It's a really challenging thing to talk about these days too, because like we said earlier, like this is a nuanced conversation, and people want to, it's often treated as a silver bullet to cure addiction. That's how I hear it talked about now.
Right.
And when I say something critical of it, I am met with a resounding voices of you know, sort of pushback, and that I understand too. But I think we have to be able to have tough conversations and nuanced conversations about things like this. Certainly when they're addictive substances, you know. I've heard of, you know, there are Suboxone clinics attached to most detox these days. So when you leave detox, you go to a Suboxone clinic.
Immediately.
Yeah. You know,
whether that may be, I think where I am finding in this long project of mine is, again, shareholders versus stakeholders. Oh, it's really good if we get everyone on this for someone's profitability, but does everyone need to be on it?
right.
I mean, it's not this cookie cutter approach.
No.
And what really struck me is how long was Corey on Suboxone?
15 years.
Did you look at the EOBs or the explanations of benefits for that? Like,
yeah,
wow.
It's
15
insane.
years.
15 years. I mean, that is when
that just hurts me for him. Like, I just hurt so much for him with that.
Yeah. No, that was a real struggle for him to get off of that. And, you know, I think there really haven't been any long-term studies on the long-term use of Suboxone. You know, I think when you talk to medical professionals and you say long-term, they're like, oh, 15 months, 18 months is long-term. And I'm like, okay, that sounds like short-term though. Like we're talking people are on this for years, you know, and a decade or more. So I think there's some question about the safety of it in the long term, you know, for sure. But I also think it's not just about safety, you know, it's about addiction. And, you know, when I was struggling with my own, it wasn't that I wanted to stop drinking. I wanted to stop being addicted to something. That sort of ball and chain was just like so painful. Like I did not want that for one more day. Knowing that I needed something from the moment I got up, I was going to spend my day fixated on getting this thing. Now, what I needed was simple. I could go to any bar and get it, you know, and I did.
Yeah.
But it's that thought. It's like it's being in chains, right? And so, you know, Suboxone, does it improve your life? Does it have that potential? Sure. But it does that by maintaining that cycle of addiction in a more manageable way. And so that person is still going to need that Suboxone every day, you know? And I really do think it should be up to the individual, you know, if they're on it, when can they stop taking it? You know, I think there's some issues around that too. Once you're on it, doctors are less inclined to take you off of it because it works. And it's like, well, if ultimately we're going to find out that there's no real harm to someone's health to take it in the long term, does that mean it's okay to have these people with a low-key addiction for the rest of their lives? Like, is that okay? And it you know, brings up a larger issue of we're changing what it means to recover. Recovery now includes the use of addictive medications.
Oh, yeah.
Which is an apparent conflict, right?
Yeah.
I mean, it sounds like it, but I'm being told that's not right. And so it does present a challenge there.
People need to be open to discussing, and that's why it's so hard on Twitter/X.
Yeah.
Man, woo, woo, woo,
Yeah.
woo. The hate, the hate, the hate. And I'm like,
Yeah.
okay, no discussions here.
Well, I'll tell you an interesting story. We had the California Society of Addiction Medicine reached out to us, very interested in Shuffle, to show at their annual conference in California.
Nice.
We were thrilled. We sent them a trailer. They watched the trailer. They said, "This is going to be incredible. We're almost sure we're going to show this at our conference. Can we see the whole film? Our committee needs to see the whole film." We sent them the whole film. We get a letter back. We will not be screening your film.
Yeah.
And here's why. We take issue with the way you talk about Suboxone in the film. Okay, fair enough. I said, "Isn't there room for conversation here?" They said, "No." That's fine. It's disappointing that the medical profession doesn't want to have a conversation about this. But we just took a step further and did a little digging, and we realized that Indivior is a financial sponsor of the California Society of Addiction Medicine.
That's what I was going to say. Like, what corporate sponsor were they going to lose at the conference? That would be something I would think about.
The major ones. And I didn't realize this, but Indivior sponsors many state medical addiction societies in this country. There are certain states that have passed laws against that. So the state of Rhode Island has written a law that says we will not allow any financial sponsorship by these companies in order to keep some sort of clarity here amongst us, But I found that really disturbing. And I understand that now makes it harder to have an open conversation about this, because Indivior is buying its way in, is buying support in the recovery industry. There are many high-profile recovery organizations that are taking money from Indivior. And I think that is a problem. Indivior would say, "No, we're giving back. We're helping." Okay. I mean, but not out of charity. I mean, you're helping because ultimately your bottom line goes up. So, it's
everywhere.
It's tough. It's very tough.
We one of my guests, Jaime Puerta, who lost his son to fentanyl. He points out all the social media companies that are now conveniently sponsoring nonprofits, like that they never had any. Their platforms were never involved in or used for this. So it's just everywhere. So they're not the only ones doing this.
No. And, it opened my eyes to the shocking amount of money flowing through this industry. And it's not, I don't mean in a fraudulent way at all. I mean, the business of recovery is big business. There's just massive dollar amounts that are being funneled through nonprofits, and they're all doing advocacy work, right? And that's great. Are the recovery rates getting any better? I don't know.
I think that's the question. Are we seeing less use and more recovery? So I know we're seeing overdose deaths drop. I would think anyone who listens to this podcast would be aware of that fact.
Yeah.
But I think it's because it partially due to naloxone, which I have behind me, being more accepted in society and more available. I don't believe it's at saturation where it should be, or we probably have even less overdose deaths, but it's naloxone plus recovery is what
I think
good recovery, what is really needed.
Yeah, I think naloxone is having an enormous impact on the change in overdose deaths, and I hope that only continues. I mean, that's crucial.
Amen.
I carried naloxone with me every day during producing this film.
I love to hear that. I carry it with me every day.
Yeah.
Anyway.
Right.
I do. You just never know, and you could help. I take it on my plane trips. It's in my purse, and no one's ever stopped. TSA hasn't said, "What's this, Aaron?" It's easy. It's not hard.
No, it's not
hard.
It's not. It should be routine.
Yes, it should be routine. I love that. Naloxone should be routine. So we're coming up on an hour, Ben. Where can people find out more about the film?
StopTheShuffle.com is our website. We also are at Stop the Shuffle on Instagram, Facebook, and LinkedIn. So on our socials, on our website, you can find out what's going on. You can stay up to date with screenings. We do have a big announcement if I have one moment to make it.
Yes, please. I would love that.
The Dallas Film Commission has started a new initiative called Screen Dallas, where they will award one documentary film a week-long theatrical Academy Award qualifying run in a theater. And this year, for their inaugural year, they chose Shuffle.
Oh, congrats.
Which is a huge honor. And that week-long run is going to culminate in a big red carpet event at the Texas Theater in Dallas on September 23rd.
Okay.
And like I mentioned at the beginning of the program, we're working on a wider theatrical release across the country could be the third week in November or so. But again, you can stay tuned on our website and socials for those dates.
Excellent. Well, thank you, Ben, for coming on.
Yeah, thank you very much for having me. This was a great conversation.
Yeah, I really enjoyed it.